Complaining won't solve the healthcare problem. We have some serious problems concerning healthcare, but complaining isn't going to help. We have to be a part of the solution by disassociating ourselves from the situation and stopping complaining. Physicians appreciate what they need and want from their professional life. There are some areas and solutions that they disagree with and about which they can't help complaining. However, the state of healthcare is not how it ideally should have been. Complaining won't remedy anything to the ongoing healthcare problems. And indeed, passivity is not the answer either. You may think complaining is just venting off, serving as an opportunity to let out some steam. But it has much more unfavorable impacts on the system as a whole and can be soul-draining for anyone who receives it. Physicians blame healthcare technology. We have been lamenting about the interruption that technological mandates have brought to physician practices in the recent decade. But technology can leverage doctors' practice only if used in the right way. According to a study, physician burnout seems to correlate with electronic health record usage directly. 40% of physician burnout is attributable to EHRs, up from the previously estimated 13%. That is why powerful technologies like EHR have met with many criticisms from physicians, some of which turn out to be accurate. With the advent of the merit-based physician reimbursement, a medical record that used to be a few lines to document now may be over 2 pages long. That is even more stressful when the time allowed for a patient visit is the same, if not lowered to 15 minutes. In 2009, when the HITECH Act was enacted into legislation, EHRs were reckoned to lessen administrative burden, lead to more cost-effective healthcare, and reduce paper waste. But so far, it hasn't. Instead has created more physician whiners. The black hat physician attitudes have not worked in their interest in information technology. Instead, it has created a vacuum for other industry impresarios, information, and the insurance industry, significantly to meddle in the healthcare realm. Doing so has uttered physicians taking a follower stance rather than a leadership role, just as physicians should assume the pre-programmed algorithms. That is why the common electronic health records use case is not in line with physician practices. The role of doctors traditionally has been standard in their profession to use their skills to treat patients. The doctor-patient relationship was one of the most fundamental aspects which stood the test of time. But many powers in the 21st century realm are seeking to disrupt the doctor-patient relationship. So being critical by default will not benefit the physicians and surely won't help the patients. Modern doctors must shape themselves as significant concerning fundamental to improve their understanding of the essential technologies during the phase of evolution. Such a process should start in the medical schools to become adept in handling the technologies from the beginning of their practice. The doctor's skill must be coherent and wrapped in the right path for creating the right implement that will aid healthcare alike. Physicians blaming the healthcare policies. As large healthcare systems and medical cultures attempt to address physician burnout, much of what they endorse eventually burdens physicians to fix the problem. Implementing team-based care to time investment, peer support, and introducing more mindfulness into practice only displaces physicians' responsibility from one form to another or swipes it under the rug. That is the reason why physicians typically complain, and policies hardly solve their problems. Today states have taken upon themselves to regulate numerous aspects of healthcare logistics from financing, assembling the necessary means through public funding, pooling resources, and overseeing the process of resource allocation. Such substantial involvement of the administration in healthcare affairs has made the core players of the healthcare system dependent on their officialism exploits. That further alienates the patients and physicians from the vision and mission of genuine healthcare. Such capacity is personal as the healthcare system is constrained to the corporate lobbyist efforts and exclusive war amongst various factions. It will indeed be adversely affected, based on political affiliation rather than patient-focused tactical missions of healthcare scholars, further estranging the medical professionals. Indeed, physicians are correct when they blame the policymakers for the wrong decisions they make. For instance, the Affordable Care Act turned out non-affordable care for those intended to serve. It raised deductibles and opened the door to surprise medical bills. Likewise, ACA didn't turn out to be beneficial for independent physicians. Also, the money that is going to the healthcare system is not producing the coveted quality. Physicians know that healthcare is not just about mandating and expanding coverage, and that they cannot improve healthcare quality by spending increased amounts of money or by raising taxes. The medical community can't afford to depend on non-medical personalities for intervention. Then again, complaining is not reducing the healthcare burden. Wrong policies are the upshot of doctor alienation from the administrative arena. Their estrangement is the symptom of their passive black hat attitudes that hinder them from taking embracing actions. That means some decisions are intended to be made based on the principle, choosing the best option we have for the time, rather than waiting for the best solution to knock our door so we can support. Physicians fault the insurance industry. There is no doubt that the insurance industry and their pharmaceutical counterparts play a significant role in healthcare costs, how much physician reimbursement should be, or what services patients are ought to receive. Then again, we often overlook the fact that the insurance industry is not a welfare organization. It has never been and will probably stay that way. So, blaming the insurance industry is just as if one indicts the lawyer for charging hefty fees for services they render or a physician billing a patient for a procedure performed. Maybe it is time for physicians to support patients to proactively engage in the competitive market. Population health, 21st century and physician burnout. Evidence-based medicine utilizes randomized controlled trials and meta-analyses as powerful tools and confirmation sources about mediocre results for various patients. They are developed as response versus poorly designed observational treatment research and physician reliance on personal experience with other patients to guide decision-making about a patient at hand. Notwithstanding, these instruments help physicians question the therapeutic regimen customized for every patient at a given point in their clinical course. That problem was not of great concern until not long ago, since technology and science were in their fancy stage. Furthermore, the general public's expectation was not as developed, given relatively limited access to high-quality information. However, with ever-evolving technological advances, patient expectations parallelly grow, demand for more personalized care intensifies, and population health flunks to provide answers to the individual orders. Physicians work harder to fill the gaps in patient expectations and experience, but they can only go so far. In other words, clinicians and specialists, physicians centrally concede that data and evidence-based support improve patients' health and survival. Yet, comparative performance reports generate unhappiness and resentment, clashing with traditional medical culture by rifting between what the reports highlight and which perspectives of medicine doctors value most utmost. Hence, the increasing discrepancy created by that rift is a significant contributor to physician complaints, burnout, and passivity. It is imperative to realize that personalized healthcare in the 21st century medical domain is necessary rather than an option or a complementary service. However, that can never be implemented if physicians continue the path of whining rather than self-reform. Value-based care and physician dissatisfaction. One of the most hypocritical undertakings of the modern healthcare administrations is implementing a value-based reimbursement system amid maintaining the population health scheme. Because value and quality are relative traits of a service delivered in a personalized environment, otherwise, such a deal can only be an outcome of a fictitious metric system. It focuses on cost control and a set of statistically driven social determinants of health and disease. Value-based reimbursement demands extra effort from physicians, adding the further reason for the already burning physician to complain. Physician decisions also affect patient care quality. Every physician understands how tough his job is and the resulting burnout it can cause. Long work hours, the burden of student loans, administrative pressure, compliance issues, and other factors leave physicians depersonalized, exhausted, and with decreased efficiency. That can feel natural to vent about burnout, but it will keep hurting if they don't do anything about it. Physicians cannot merely change the external factors accountable for their frustration and burnout, but they can change the practice's nature. They need to adapt to technology. The attitude of defying technology, kicking the can of policies down the road of politics will not help them in the long run. You have to begin somewhere and slowly. Only then can we expect the external factors to change. We need to understand that healthcare consists of multiple aspects like quality of care, supervision, information management, patients, providers, expenses, interdisciplinary interaction, and influenced by social perceptions and socio-economic conditions. Unless we can create a balance, we won't have harmony within our professional lives and only keep complaining. We can make things more straightforward, transparent with the right solution. It won't work like magic, but we can start someplace. We should begin by developing an open and free healthcare market where healthy competition can flourish. Within such a system, every individual should be able to have the opportunity to make an informed judgment based on awareness generated by healthcare services and governments. Practices like the population-based model tend to overlook the personal needs of the patient. The model is aimed at a population with lesser awareness and education. But in the age of the internet and information, patients have become more knowledgeable. Personalization enables patients to get what they need, and physicians follow what they want instead of establishing norms. Staying healthy is an individual right, and that makes it a personal choice to stay healthy. We can solve many of our performance and efficiency problems by bringing personalized healthcare to every human being.